Hi, everybody. Thank you so much for joining us today. My name is Nicole Lamberson, and I am a physician assistant and a member of the Medicating Normal team, where I volunteer doing outreach for the film and facilitating important conversations like this one. I'm so excited today to bring you this interview with one of the wonderful individuals we met along the journey of screening the film Medicating Normal. Our guest today is Dr. James Greenblatt. A pioneer in the field of integrative medicine, Dr. Greenblatt has treated patients since 1988. After receiving his medical degree and completing his psychiatry residency at George Washington University, Dr. Greenblatt completed a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. He currently serves as the Chief Medical Officer at Walden Behavioral Care in Waltham, Massachusetts, and serves as an assistant clinical professor of psychiatry at Tufts University School of Medicine and Dartmouth College, is it Geisel?
Very good, yes.
School of Medicine. Dr. Greenblatt has lectured internationally on the scientific evidence for nutritional interventions in psychiatry and mental illness. He is the author of 7 books, including Finally Focused, The Breakthrough Natural Treatment Plan for ADHD. He's the founder of Psychiatry Redefined, an educational platform dedicated to the transformation of psychiatry, which offers online CME-approved courses, webinars, and a fellowship program for professionals in functional psychiatry. You can find Dr. Greenblatt and some of his work at psychiatryredefined.org, jamesgreenblattmd.com, and Lowdose lithium.com. So thank you so much for joining us today. Dr. Greenblatt, we're really excited to speak to you. And is there anything else you would like to say about yourself, just as a sort of introduction?
No, I think you covered it. I mean, I think probably the most important part of what I can offer doctors and patients is that I've been for 35 years involved in, all aspects of psychiatry, meaning treating patients who are in hospitals, as well as treating patients who are outpatients. So I think it's important that we understand the wide range of pathology and the use or misuse of medications across all those levels of care.
Okay. So for people who don't know, what is integrative medicine and what is functional psychiatry? Are they the same? Are they different? And how did you become interested in them in particular?
Well, I think I started my journey actually in college with a different term. I found orthomolecular psychiatry, the work of Dr. Hoffer in treating schizophrenia with high-dose vitamin B3. And again, college, before I even knew I wanted to be a psychiatrist, I was very interested in nutrition and brain function. And that was called orthomolecular psychiatry. And it was based on the fact that everybody has different needs nutritionally, and some might be more vulnerable to mental illness. And then when I graduated medical school, just beginning this concept of functional medicine, and functional medicine is looking at the kind of root cause of illness, be it diabetes or autoimmune disorder. Is it a nutritional deficiency, a toxin, stress? And so the core of functional medicine is looking at the root cause. And I think integrative medicine is becoming much more accepted. To me, those are the more modalities around mindfulness and yoga and spirituality and faith and connection and all these exercise and lifestyle that's critically important for our health. I've just found that integrative medicine was often not enough for our patients struggling with psychiatric illness. And I found functional medicine looking more deeply to be kind of a natural bridge. So long-winded answer, I'm sorry, but it's really the combination of integrative and functional medicine that I call functional psychiatry that I think is the most effective way of treating patients with mental health issues. Okay,
that makes total sense. So you talked about functional medicine, functional psychiatry causing or finding root contributors to mental health disorders like depression, ADHD, eating disorders, addiction, that kind of thing. So what are some root contributors maybe that we wouldn't think of?
Yeah, I mean, the list is pretty endless, and that's why, it takes training. Some of it's common sense. I kind of, in our depression book that we wrote, I used the mnemonic, the zebra, with 2 E's, and each letter stood for a different, modality to think about. But it was everything from, understanding trauma and stress, to understanding of B vitamin deficiencies, trace mineral deficiencies, the gut, the celiac disease and digestive problems getting in the way of absorbing nutrients. So the toxins, be it cadmium, mercury, or lead affecting brain function. So it's quite a long list. And that's why some of the frustration is clinicians just taking guesses and saying everybody, with schizophrenia should, be on a gluten-free diet. Well, I can share with you, there are many individuals who benefit from gluten-free diet, but not everybody. And that's the functional medicine approach, is looking and testing for these underlying causes.
I see. So tailoring it to each individual.
Absolutely. It's the only way to do it well, particularly those that have struggled for a long time.
So is what is labeled by mainstream psychiatry, I guess, as a mental illness, are those truly then brain diseases? Because the term mental, I guess, in front of illness makes people, think of the brain only. But what you're talking about is all of these root causes. So can there be, transient physiological states that can cause people to present with what I would say is so-called mental illness because it's transient? Like I'm thinking of maybe like a wrestler who's, cutting weight, getting ready for a match, but he's not eating properly. He's exercising much more than he would be normally. And he's, underweight, and he starts to become extremely anxious. But
No, absolutely.
Yeah.
Yes, no, that's the core of this functional psychiatry, because, I make that joke that, psychiatrists forget there's a neck, right? That the body is connected to the head, and what's happening, in the rest of your body will affect the brain. So, I mean, it could be from a thyroid problem to an infection. COVID has actually helped us appreciate, how the immune system can affect brain function. And you're right, someone restricting their calories, whether it ends up with anorexia or, a wrestler trying to meet weight, I mean, that will affect their ability to think clearly. And if it goes on too long, can have damage to the brain. So what happens in the body happens in the brain.
So you watched the film Medicating Normal yourself, and some of the feedback you gave was that you thought exposing the scope of the issues covered in the film was critical, but that you focused more on the other half of the equation, which is solutions to the issues. So how do you think we need to rethink psychiatric intervention outside of the current mainstream symptom-based drug treatment models? And do you yourself still use psychiatric medications or find them to be useful tools in treating people?
Yeah, great questions. I mean, I think the reason I started our educational program, Psychiatry Redefined, is because I think we're in just desperate need for a new model. I mean, this model, starting, with the Valium and then the Prozac as a kind of symptomatic-based treatment model, regardless of any etiology. If you're anxious, you take benzo. If you're depressed, you take an antidepressant. And now everyone takes an antipsychotic for anything and everything. So there's kind of mindless prescribing that you have seen, I have seen, just the damage, the side effects, be it, aggression, irritability, sex drive, even suicide. So it's really out of control. So that symptomatic-based treatment model has not helped, and the outcome studies are pretty poor. But I'm certainly not in the, I call it the toxic psychiatry. Some of the marches I've seen where people really believe psychiatrists are trying to hurt people. I think it's just really out of ignorance and not having a model. And as an inpatient psychiatrist, absolutely, I have used medicine for someone who is psychotic and manic, or someone who can't eat and is dying. So I think there is a role for medicine. The problem is my field, is just way out of control in kind of not having any other tools, just prescribing one medicine on top of another. And they never stop the first one. And polypharmacy is the rule now, and it's just not, I think, the most helpful path to treating mental illness.
So because you think medications are useful tools and still necessary for some people, what kind of informed consent do you think patients should get before they're prescribed anything? And do you think we can still get to root causes of people's mental symptoms or physical symptoms if they're taking medications? I'm just thinking, like, do medications mask or disrupt things to where, you couldn't ever get to a root cause in someone?
I think that, well, let's take informed consent first. I think it's just such an important point. So I'm just finishing up a book on antidepressant withdrawal. And, in doing the research for that book, it just truly amazing me that I think a couple studies showed that only 1% of patients said they were given informed consent that they might have severe withdrawal from antidepressants, which is really kind of mind-boggling to me. So informed consent is not consistently part of, prescribers' routine in psychiatry. And certainly if they talk about headaches or stomach aches, maybe even mentioning suicidal ideation on an antidepressant, they're not necessarily talking about withdrawal, sex drive, and all the other ones. So informed consent is a big hole, particularly with our antidepressant withdrawal. I think that to me, as a clinician working with patients every day, it's that kind of therapeutic alliance and kind of non-judgmental approach that I think is really important. If someone is not acutely ill and looking for a kind of integrative functional approach, then medicine's not part of the discussion. We work at searching for these underlying causes. If someone is so profoundly distorted in their thinking or depressed and suicidal, I do find that we can use medicine to start the process while we look for those causes, which could take months. And the way I would approach it, cautiously, with one medicine, I don't believe they mask any of the issues. What the field has done, though, is then people might be taking 2, 3, 4, 5 medications over many years, and then that creates a whole kind of cycle of other problems, and then a functional approach just gets more challenging.
So one intervention you speak of often in your talks is low-dose lithium. All I can think of when I think of lithium is all the kidney problems and things that I hear about. So is low-dose lithium safe? Is it different? And how is it useful as a tool for treating mental health?
Well, this weekend, April 17th and 18th, we have a 2-day conference on low-dose nutritional lithium from experts around the globe. And when we talk about low-dose lithium, we're not talking about a medication. We're talking about a mineral that's found in our food, in the earth, in our vegetables, in our water supply. And it's essential for brain function at these micro dosages. The literature, the scientific literature, is so profound That's why this weekend is one of the most exciting moments of my professional career, to hear all these experts and participate in this, what this mineral potentially could do. And the research that'll be described is that these very low doses in our food supply or nutritional supplements could affect the risk of suicide, the risk of dementia and Alzheimer's, and decrease aggression and violence. And we have 30 or 40 years of research supporting that. And that is very different. So we're talking about 1 or 2 milligrams. You don't need blood tests. It doesn't affect the kidney. It doesn't affect the thyroid, all the things that we worry about with prescription lithium. So it's very hard to prescribe prescription lithium now, even though there's plenty of evidence that it helps, because of, as you described, kidney damage, thyroid damage, other side effects at the dosages that sometimes can be used for lithium carbonate for bipolar disorder.
I see. So where can people find that conference if they want to attend? Is it virtual or?
Yes, it's a virtual conference. Psychiatryredefined.org would have the link to this conference. And not to be dramatic, but as I looked through the speaker slides this morning, I mean, I believe that this could really, shift the paradigm in how we treat mental health and illness, because the role of this nutritional lithium is refocusing our treatment model on prevention. And psychiatry and mental health, we just don't do that. Cardiology, we talk about exercise and lifestyle to prevent heart attacks, but nobody talks about prevention when we talk about mental health.
Yeah. So someone in the audience watching says, is he talking about lithium orate or carbonate? Orotate or carbonate, I think they mean.
Lithium orotate is the most common low dose form available. Yes.
And can you get all of it from food, or do you have to supplement?
Well, great question. I think that we've been testing lithium in people's hair samples for 30 years now. And the lithium that you get is some from food and most of it actually from tap water, because it kind of in the soil leaches into your tap water. And different parts of different regions around the country, different regions around the globe has differing amounts of lithium in the water. Even in states, in one part of a state, you might have a certain amount in the tap water, another part, a different amount. So where you live is really important in understanding how much lithium you're getting from the water. And the research that we have over 30 years with new studies that came out last year is that the amount of lithium in the drinking water in your community does affect suicide rates. Higher lithium in the water, lower suicide rates.
Wow.
Very dramatic research.
That's very interesting. So regarding functional psychiatry, and it's something here at the film and just doing work around these, mental health topics that I've been doing for 10 years, that people will say, well, this, it all sounds great on paper, these alternatives and things, but the way healthcare is set up, at least in the United States, you have to have insurance to be able to afford some interventions. So is there any coverage for functional psychiatry in the United States or in some other countries that have universal policies?
There are certain aspects of functional psychiatry that, is covered by certainly all insurances, even Medicaid and Mass Health. And, but there's a subset of some of this functional medicine that is, a medicine for the movie stars. I saw somebody charging $1,500 an hour to do a consult on a patient, and some of the testing can be thousands of dollars. So there is a very distorted socioeconomic play with functional medicine that has to change. But some of the core psychiatric tests that we might look at can be done by every insurance, Medicare and Mass Health, and everything from a vitamin B12 level, understanding that some of the normal levels that our doctors think are fine can have profound implications for depression, anxiety, even psychosis. Mm-hmm. Vitamin D levels, iron, mercury, lead, and there are a number of zinc. These are all kind of tests, celiac disease, that can be done and covered by insurance. So there's so much that we could do.
Yeah. I'm just thinking of my own experience with, mainstream psychiatry. I was never tested for anything going on in my body. It was just a conversation, really. And my diet was never discussed or anything like that. And I found just in my own, tweaking of things myself and eating a new diet that I tried, I stopped biting my fingernails for the first time in my entire life, just from changing the way that I eat. So I'm a firm believer in that you can adjust just the way that you're caring for your body and notice, changes in your mental health.
Yes, and we have research to support it. It's not just, you and I or individuals speaking that way, but, for any other medical specialty, we wouldn't tolerate, going to the gastroenterologist or the cardiologist and them sitting across from us and asking us a bunch of questions and saying goodbye, right? We want to know what? We're going to get a blood test, a CT scan. They're going to know exactly what's going on. And it's, to me, one of the biggest tragedies of psychiatry that our profession does not address lifestyle, does not address diet, does not do these blood tests to try to understand some of these medical, nutritional, or physiological causes.
So one question that comes up frequently that I see in the psychiatric drug community, where people are, taking the medications and trying to get off of them, is they encounter a practitioner who says, we can check your levels of, serotonin or dopamine in your blood or urine or saliva. Are these accurate tests, and do they actually tell us anything, or is that like a scam?
Well, I would have to say it's somewhere in between. I do a lot of testing. My whole career in practice is functional testing. So amino acids and fatty acids and organic acids in the gut. So I could go on from testing, but the truth is, to answer your question directly, I have not found neurotransmitter testing, particularly in the urine, to be particularly helpful for me to treat patients with major psychiatric illnesses. I think some of the companies, are looking for relationships. I just doing this for almost 40 years now. I have not found these neurotransmitter tests to be consistent and predictable, and that's why I can't ask patients to do that.
Okay. So you do a lot of educating now, I know, and in your bio, we listed a lot of, well-known universities and that kind of thing that you're associated with. And when you present these concepts of functional psychiatry to, your more mainstream counterpart psychiatrists, are you facing any pushback or skepticism, or do you think people are becoming, more tolerant of this alternative approach?
Well, I hate the word alternative, because I think we need to convince everyone it's not alternative, it's just good medicine.
Yeah.
And I think, 30 years ago, it was challenging. I think I've lasted in the profession primarily because for 20 years, I've been primarily in hospitals treating patients with eating disorders. Mm-hmm. So these were malnourished individuals, men, women, young, old, who were starving. So I get to talk about, malnutrition, zinc and magnesium and essential fatty acids. And so that kept me going. And when I gave grand rounds to traditional group, I would talk about nutritional deficiencies in our anorexic patients. So that made sense to them. I would say over the 20 years now, people are asking for the information. So traditional psychiatrists, training programs are looking for everything from the integrative, mindfulness, as well as nutritional and functional. So it's slowly changing, not quick enough for patients and people walking into doctors' offices, but I do think the community, the next generation of psychiatrists and people my age who are trying to shift their career are much more open to understanding these models.
And do you find that the younger trainees are more open to it?
I find many of the younger trainees are, but I'll share with you what I've seen a lot is actually people that have been practicing psychiatry for a while and developed their own health problems, right? And guess what? They couldn't find any relief from traditional doctors. And they went to a functional medicine doctor for their own health, not mental health. And they felt better. So it kind of triggered them rethinking what they're doing for a living. And that's been a large core group of the people that we're training in our courses and seminars is doctors that have found functional medicine on their own and now trying to integrate it into their practice.
That makes total sense. As somebody who took, psychiatric medication and was, trained as a PA in sort of the more mainstream, and then getting sick from traditional medicine, it sort of makes you have a big wake up, about what we really know and what we're doing and, what's wrong with the current approach, really.
Right.
So your website says it's dedicated to the personalized evidence-based treatment of mental illness. So I hear that phrase evidence-based all the time now. And it's used also for, mainstream psychiatry, really. But we know that a lot of the science has been corrupted and things that are called evidence-based aren't really evidence-based. So how could a patient really suss out what is truly evidence-based? Are there any tips or tricks?
That's a brilliant question, Nicole, because you're absolutely right. The term is kind of that catch to say that there's research. And we know that you can manipulate the research and the data any way that you want and how you market it. I think in terms of when we use the term, we're talking about for some 20, 30 years of research that's just ignored. Some of the, in good journals, academic, one of the most dramatic is looking at a blood test called homocysteine. It's a marker of B6, B12, and folate deficiency. And it has tremendous predictive value to develop dementia and Alzheimer's. And these were a group of researchers from around the world. It was called a consensus paper. And very dramatic difference. So a simple blood test that we could, if homocysteine was high, we could bring down B6, B12, add B6, B12, and folate, and dramatically decrease risk of dementia. But that research is completely ignored. There's no pharmaceutical industry pushing it. There's no TV commercial. And so part of the way we use evidence-based is trying to get some of this research that's already there and help people understand celiac disease associated with depression. 30 years of research, nobody looks at it. But the other important point, I think that was in between your question, was the value of just clinical medicine and observation. A lot of the work that we do, there's no pharmaceutical money, there's no kind of advertising dollar, and there's not going to be any research. The vitamin D, we've heard a lot about it with COVID. There's tremendous amount of research that has been ignored by the media, but certainly is out there on vitamin D affecting COVID hospitalizations, ICU visits, and death rates. But we also have hundreds of articles on vitamin D and mental health, schizophrenia, depression, etc. But there's not going to be more research. There's not going to be money being funded for some of these things that aren't profitable to some company. So we have to balance looking for the evidence to also looking at kind of clinical experience and even common sense.
Well, it can some evidence-based then be like I said, I stopped biting my nails. Is the patient's experience trying things that you might present to them as a functional psychiatrist? And if they make them feel better, is that evidence or is that just anecdote, really?
Well, I mean, it's a clinical story that we add. And, another project we're finishing up is, trichotillomania and hair pulling and biting. And we absolutely have seen, and it came upon by accident, similar stories that you've described, when people started getting better with certain nutrients or probiotics, that we started exploring it. And that's why Psychiatry Redefined is so important to me, because we're kind of growing a community of psychiatrists and sharing, and nurse practitioners and nurses and health coaches to share information and ideas, because we have to capture those clinical stories.
Okay. So since our film, Medicating Normal, is about the harms done by psychiatric medications, I want to touch some on withdrawal from these agents. What kind of nutritional or other functional support can assist patients through psychiatric drug withdrawal that you've learned about or seen in your clinical experience working with these patients?
Yes, I've pretty much, I would say, almost 8 years, maybe 10, I've not had patients have withdrawal from antidepressants because of this functional model. I think they're just a bizarre range of articles by the psychiatric community, where some doctors are saying, stop cold turkey. Some are picking these random things, cut 10% a week. Others are saying you have to stay on the meds for life. There's really no support. By this functional model, particularly before someone stops an antidepressant, looking at these nutritional deficiencies. And again, we've got a whole book, so it's not just one, but B12 is probably the most common, folate, B6, very, very common, and they're all related to serotonin synthesis. Mm-hmm. And if we look at these tests and we treat before we stop the medication, then a slow taper, I'm quite confident, can be done without any side effects. I mean, it's just tragic when I read some of these, consumer websites where people are just the doctors won't help them stop the medication. So, patients are just helping each other. But there are not many things I can say with 100% certainty in this field, but the withdrawal problems, I think we pretty much figured out by looking at this broad range of functional testing.
Mm-hmm. What about people who've already done everything wrong, who've cold turkeyed or they've sat in a protracted withdrawal syndrome for months and years and they're incredibly ill? Is there functional help for them, or is it just too late?
No, absolutely. The big picture, is for all of this functional integrative work, the core of our clinical work is that everybody's different, right? We call it biochemical individuality, uniqueness, you're extraordinary, however we want to call it. And that's for antidepressant withdrawal, for everyone that we know that has struggled with horrible side effects. There's someone else that never had a side effect. They just stopped it and they did fine. Yeah. So there's something physiologically different. And ideally, we try to figure out before they stop. But for someone that's already stopped their medicines, we can continue and look at some of these same deficiencies and definitely support them feeling better, because the reason that they went into those that kind of neurophysiological symptomatology is because likely due to abnormal serotonin synthesis or utilization.
So we talked a little bit about supplements, like with the lithium and you talking about some of the deficiencies. But it feels to me sometimes that like people have this false sense of security with supplements from, thinking like, oh, they're natural, they're never harmful, because you can buy them over the counter. And, but I'm wondering if supplements are, can be as dangerous as prescribed medications. Can they have interactions with prescribed medications that people are taking? And what about things like kratom and phenibut, that can cause physical dependence and withdrawal? Are there uses for those, or are they just dangerous?
Yeah, I mean, the last two you mentioned are kind of not on my list, and I would obviously say caution and not use because I think they're complicated. But I'm a little worried that people trying to look for, this integrative functional approach, they would just prescribe supplements almost as blindly as medications. They just say, oh, take 5-HTP or take this supplement without really doing the testing or without really thinking. And that's a little scary, and that's happening more than I would like, particularly on Facebook and other places where people just make a recommendation. I have a depressed person and 20 people just tell them to take different supplements and there's no understanding. But I think your first point is very important, that we have seen significant side effects to some supplements. Again, working in a hospital, I've admitted patients who developed mania from supplements from St. John's wort, a bipolar patient taking St. John's wort. A bipolar patient, didn't know they were bipolar, family history, who took a supplement called STAMI. And that can cause mania. I've seen too many people give a supplement called 5-HTP to young children. And for some patients, it can be very helpful. It's the precursor to serotonin, but it can also cause a lot of agitation and GI discomfort. So there are side effects, and I think practitioners need to be aware and understand the side effects. There are not a lot of drug nutritional interactions. There are some, but it's mostly not understanding the side effects of supplements. They're not all benign.
Yeah, when I said interactions, I guess I mean like, can they compete for the same liver pathways for metabolism and then like maybe raise your level of a medication that you were taking by chance?
Certainly some of the not necessarily the vitamins, but certainly some of the herbal supplements has a broad range of effect. And certainly there are some drug nutrient interactions that you need to be aware of.
Yeah, okay. So you mentioned Alzheimer's and the word prevention, which I feel like in society now, we are so much of like a Band-Aid type thing. We just want to slap something on top of it and cover it up instead of, like you said, root cause type thinking. So what kind of advice would you give to people, parents raising kids or adults themselves who maybe don't have mental health issues, but they are looking to prevent that type of thing in their children or in themselves, or Alzheimer's down the line? Are there things we can do functionally to help ourselves, looking ahead?
Yeah, I mean, I do think that psychiatry, as we said earlier, has been devoid of any model for prevention. I think the Alzheimer's literature is very clear now that there's a 30-year progression of this illness. And it's very hard to treat end-stage Alzheimer's, but it appears there are many supplements and lifestyle changes that 30 years before the onset can have profound effects on the risk of Alzheimer's. In terms of parents, I guess it's hard for me not to mention, anorexia nervosa, eating disorders. Big headline, some big star in England just died last week, but every eating disorder facility has waiting lists now. It is just increasing dramatically, and anorexia nervosa is a life-threatening illness. It's the highest mortality risk of any psychiatric illness. We don't think about that. We don't talk about it. And I absolutely believe that prevention, can be understood, particularly for, young teens as they change their diet and or just try to lose weight. So I think it's really important that parents understand, the consequences of dietary changes. And I don't want anybody to throw anything at me, but, a vegan diet in a, pre-adolescent is one of the most significant risk factors that's been looked at for anorexia nervosa. Because a adolescent does not know how to get all the nutrients that they might. A vegetarian diet with dairy and eggs are better, but a vegan diet is severely deficient for an adolescent getting through puberty. And I try to caution parents to not allow that until they're older, or monitor with their doctor to make sure they're getting adequate nutrition.
So on the topic of diet, do you have a specific one that you like or promote, or you don't go there?
Yeah, I don't go there just because the other part of my world from anorexia is binge eating, and we know diets fail 90% of the time, and it's just deprivation. So we don't really go with the concept of diet. I think it's destructive. I think there are variations. There's a growing literature on a ketogenic diet for a major mental illness, and I think there's a place for that. But I think more important is, what I call the undiet in one of my books is eliminating certain things rather than a diet plan. And those would be things like high fructose corn syrup, refined sugar, and, in the binge eating book we wrote, monosodium glutamate, all affect the brain and can all affect how we kind of regulate blood sugar and appetite.
Okay. Yeah, the ketogenic diet is the one that saved my fingernails, by the way.
Oh, great.
Yeah. And it also helped a little bit in psychiatric drug withdrawal as well.
Yes, absolutely, yes.
So on eating disorders, does functional psychiatry have better outcomes? Is there literature to show that? I know like you said, it's incredibly hard to treat and can be lifelong for people. But is there literature that shows that the functional approach is better than what we're doing, with just medicating these people?
No, there's no literature. In a few months, I'm going to republish my book, Answers to Anorexia, with hundreds, if not thousands, of references looking at a different model, this model of malnutrition that can be utilized. But again, there's no pharmaceutical money, so it's unlikely to be any research. But doing this for 30 plus years, those patients and families that can adopt these nutritional interventions and supplements before the illness becomes such a black hole of distorted thinking, where some individuals would rather take their life than gain weight. I've just seen it to be very, very helpful.
Great. So I'm looking at the time, and I know you have to go soon. So just one more question. What resources are good for people to check out if they want to learn more about functional psychiatry, like your own work, or do you have, functional doctors that you like and respect? I like Chris Kresser a lot. I don't know if he's considered functional, and I like Mark Sison. I don't know if you've heard of either one of those, but
yeah, both those I think would consider themselves functional practitioners and certainly well balanced. There's a lot of doctors out there claiming to be functional. My only caution is, finding somebody who is a mental health practitioner as well. So I've just seen there's been a lot of psychiatric nurse practitioners who are studying functional medicine. you certainly can get a lot of information from a general functional medicine doctor, but for those on psychotropic medications, try to get someone with experience with the medications and the diagnosis that you were given. And that's a growing group. I think on our website, there's a list of providers who've taken our courses, psychiatryredefined.org, and there are growing groups of clinicians that are getting this training and trying to improve outcomes for patients that have been struggling.
Okay. So that's all the questions I have for you. Do you have any other closing thoughts or anything else you'd like to add before you get on with the rest of your day?
No, I have to say, Nicole, yes, that was some of the best questions I've been asked in many years. I do really appreciate that because it helped, I think, articulate the problem, and hopefully it leaned some people towards some hope, because I do think there's a lot of hope. And there are solutions out there. We just got to educate more doctors.
Okay, great. So thank you so much for being here with us today, Dr. Greenblatt. If you have to go, please feel free to just turn off your Zoom. I'm going to say a little bit about the film and where people can find us and stuff as closing thoughts. Okay. And please do keep in touch with us and us with you. And hopefully people will also attend your Lithium conference too. That sounds super interesting.
Okay, and if anybody is concerned about the conference fee, that we're happy to have a sliding fee or scholarship for this conference.
Would they just contact through your website to get that, or?
Yes.
Okay. Okay. Thank you so much. Okay.
Bye-bye.
So thank you everybody for joining us. There'll be more interviews like this one to come. If you have not seen Medicating Normal yet, please check out our website at medicatingnormal.com/watch, where you'll find a list of upcoming community screenings, or you can check out the events tab here on our Facebook page. We add more screenings under the under medicatingnormal.com/watch all the time, and we update the list frequently, so check back often. We currently release new videos on our YouTube channel every Wednesday and Friday at noon Central US time. And we'll be having more live interviews on Facebook Live every week or so stay tuned for those. If you'd like to support the outreach efforts of Medicating Normal to bring the film and conversations like these to more communities worldwide, you can make a donation at medicatingnormal.com/donate. Thanks everybody so much for joining us today, and special thanks to Dr. Greenblatt for spending this time with us. And goodbye everybody, and we will see you all soon. Take care.